on ITU or get seriously ill with COVID. It does protect you from getting seriously ill. So you must go whenever you're invited. I wouldn't suggest you to call up your GP and ask them when you're getting the vaccine, but you will automatically get invited through the letters which will go out, which go out nationally. And when you are invited, then you try to book your appointments through the national booking service.
And people have been hesitant in over the last few months about the vaccine because they've heard all this rumours and things. What is the truth about the rumours about the vaccine in regards to it can track you, it changes your DNA, it affects your fertility? What is the truth about these things?
So obviously these are all myths. It does not affect your fertility in any way. It doesn't track you. Actually, you can be more tracked through your mobile phone than be tracked through a vaccine. It does not change your DNA in any way. It does not give you coronavirus, because we have had questions around that as well. So it's absolutely safe to have the vaccine, and loads and millions. I mean, in Leicestershire, we've crossed 500,000 as well. And across the country, more than half the population of the whole of the UK has got the vaccine now. So, it is, and people are fine. People are safe. I mean, I've had my vaccine myself and absolutely fine. So it's not going to do any harm to you. But what you want to do is have the vaccine, because that protects you from getting seriously ill and dying or being seriously ill on ITU with compared to any risks from the vaccine. So the vaccine is really safe, and I would suggest where possible, whenever you get called, please do go ahead with the vaccine. So all these are myths. They're all absolutely myths. It is absolutely safe to have the vaccine, and you must go and have the vaccine whenever you're called.
And lots of people, if you look across the world, lots of countries are racing now to get the vaccine. And unfortunately, in India, they haven't vaccinated enough of the population. And all of a sudden, the public just eased their guard, and social distancing wasn't followed, masks weren't worn, and that's affected that country quite dramatically, hasn't it?
It has. And that is exactly, we did see that happening in India around the month of, I think, January, February, when they started relaxing all the rules. And about that time, the vaccine hadn't come. And clearly we can see the implications of what happened, the after effects of what that has happened. And that's why, learning from that, we should all pick up, you don't want to experience it yourself. You want to pick up the learning, what you're seeing in other countries, and ensure that you are safe. You follow and don't lax your rules. You follow the social distancing measures. You follow all the right measures, because what you don't want to do is go back to where we were in wave 1 and wave 2. We really want to be on our guard, make sure that we are very, very safe, and do so. When we are safe to do so, we will let you know. So, the vaccines are really the best way, absolutely the best way to protect you from getting seriously ill with COVID. So please do not, underestimate the value of this vaccine, and just, whenever you're called, please do go for it. It's absolutely safe to have it.
And I think because it's available here in the UK, and it's widely available, and the government is actually asking people, the NHS is asking people to come forward and have their vaccines. Lots of other countries don't have that luxury. Lots of people are struggling across the third world countries, across the world. Countries are desperately waiting for the vaccine. And here we are in a position where we have the vaccine available, and people are saying, oh, I'm not sure I want it. That seems really odd.
It does. And that's why, we want to urge everybody that, don't really underestimate what COVID can do to you and how it can actually harm you, and how, because nobody knows which one of us will get it, and when will, we see us, sometimes we say, oh, well, our neighbors had it, they were not ill in ITU, or this one had it, they were not ill. But it doesn't matter how the neighbor or somebody else was affected. You don't know how it can affect your own body, and where will you land up with the, and those who have had it, some of them who have been seriously ill and who have come out of ITU, they will tell you that, it can really completely, really affect you, because it's not just the COVID at that time, it's the long COVID, which has also had an impact. So, you can get COVID and you can have the after effects of all that COVID, which can last for months and even up to years. So that's why this vaccine will actually stop you from getting seriously ill and getting you the long COVID as well. And that's what you need to look at, because that is such an important thing. It's not just the COVID, it's the after effects of COVID, if you have had and if you've survived, what it can do to your body and how it can affect you.
And lots of people have had the vaccine in Leicester, as you've said. Lots of volunteers have been working. How busy is the NHS here locally in delivering the vaccine?
So the NHS has been at the forefront to deliver this vaccine, and we have worked very collaboratively with all of, general practice has been at the forefront of it. We have had the LPT, we have had the hospitals. Everybody has worked collaboratively to deliver this at scale. And, it's a collaborative effort of everyone, which has really made this actually work through and be able to give it to all the population who need it the most. So, we have been extremely busy. We have, done this at a scale which we have never done before in the years I have worked in the NHS. I've never seen this, so it's a fantastic effort. And I think we need to recognize all the hard work which all our, colleagues have put into it, including our volunteers, including our other ambulance services. Everybody has been at the forefront to deliver this vaccine to basically to save the lives of our public. So, it's been extremely busy. We have done a fantastic work, and we're still carrying on this work, because as we're going down the cohort, so we've covered most of the population over the age of 50 years. Now we're going down the population to ensure that all our lower age cohorts, up from 40 years onwards, are also covered with the vaccine. So yeah, but a fantastic effort by everyone. And it's been, NHS has put it, it's been a very, very challenging time, but everybody has first thought of the public, of the patients, and they want to do it. They want to keep their patients safe. And that is the role of the NHS, isn't it?
Exactly. You say, where are we at this moment in time in Leicester and Leicestershire as regards to the age groups that you're currently being vaccinated at this moment in time?
Yeah, I think we did all the over 50. So that was cohorts 1 to 9. We have done all the over 50s population and all the high risk population. Now we're slowly going down the cohorts to 49, 48. And, slowly we'll go down, I think, up to 45 years. And then we're going to go down slowly as we complete each cohort. We go down to up to the 40 years as well. But at the minute, I think we're at the 45 age group at the minute. So
when somebody is called, they should go along and have their vaccine done, not just to protect themselves, but to protect their families as well. Is that correct?
Absolutely, absolutely. You're not just doing it to protect yourself, but you're doing it to protect your families, because if, obviously you don't get seriously ill with COVID, but if you catch COVID, at least it will not be as severe and you will not be able to, it won't be at that severe level. So you have to do this not only to protect yourself, but to also protect your loved ones and the families. And, we in Leicestershire, we live in multi-generational households. We've got big families. So we're doing it not only to ourselves, but to protect the loved ones who stay with us as well. So it's really important. You will get the letter. You do not need to contact your GP for the vaccine. You will, but of course, if you have been over the age of 50 years and have not had anything as yet, then of course contact your GP. But if you're under the age of 50 years, and you will get the letter, you will be called for the vaccine when the vaccine is available. So, do not contact them, but we will contact you and ensure that you get your vaccines.
Excellent. Thank you very much. And, one of the questions that always keeps popping up every now and then is how is it that the vaccine was produced so quickly and was approved so quickly?
So what I would say is, when obviously the pandemic happened, nobody expected the pandemic to come up. This was such an unexpected thing. So all the tracks were cleared. So it wasn't done. So when the science behind it stayed the same, everything, what you need to approve the vaccine stayed the same, but all the other admin work and everything was, that was done quickly to ensure that the vaccine gets approved. It's like, if you had the Prime Minister traveling from London to Leicester, and if they were going, you would move all the traffic aside. You would let them go first. You would let them pass through all the, they wouldn't be standing in traffic for hours and hours. So you would move all the traffic aside. It is exactly that sort of analogy if you use that the admin part of it, that was escalated and made sure that is, done quickly. But other part, the science behind it, how it's actually being tested, everything was done as you would do for a normal any other vaccine. So, please be assured that this was done very, very safely before it was approved. It was approved by all the FDAs, by the MHRA. Everybody had approved it before it actually went, to be given to the public.
And one of the other questions that keeps cropping up is, why should we still be wearing masks? Most people are vaccinated. People are, not. Do they still need to keep their social distance?
Absolutely, because there is no guarantee that you cannot catch COVID, because there are studies happening on it. And once obviously we hear more from the studies and things, but at the minute you still need to wear your mask. You still need to keep your social distancing, because nobody is sure as to, we know the vaccine is providing protection, but we also know variants keep coming up, different things keep coming up. So we need to wait till we get the absolute yes from from the high authorities to tell us that, we are absolutely safe, because otherwise there is still a risk of you catching COVID. There's still a risk of you transmitting COVID. So hence we want to minimize that. We do not want a third wave. We want to be very, very careful, and we want to ensure everybody's, because there's still a chance that you can catch COVID. And unless we actually get from the high authorities that this is all, it is 100%, you've had the vaccine, you've been had the thing, we cannot lax ourselves. So we really need to follow all the measures currently.
Thank you very much, Sonaxi. Really good to hear all those comments, and thank you very much for the NHS and all the work that your GPs and your colleagues in the NHS here locally in Leicester in primary care are doing. I know it's been a busy, busy time. Are the GPs and the primary care teams tired of all this almost non-stop 1 year of busy, busy work?
They have been working tirelessly. It has been very, very exhausting, I must say, because it's not just giving the vaccines, it's carrying on your day-to-day work, the needs of the patient, whatever the patient, we are still carrying on the other work as well. The practices have been open and done all the other work as well. So, but you know what, I think, we all go through these challenging times, and it's one of those testing times, but then you do it because that's what you do for your public. What you do for your patients? And they're just still carrying on. And it's hard work, but it's very, very satisfying as well, I must say.
And are GP surgeries open and they are doing their normal job? So if people have got issues with their diabetes or back problems, or they feel unwell, how is that taking place at this moment in time?
Absolutely. So the GP surgeries have always been open. They were never closed. Even through the entire pandemic, they were never closed. They were always open. So if you have any concerns, if you've got any medical concerns where you think you need to speak to the GP, please do contact your GP. How they might do the consultation might be a bit different. They might first speak to you over the phone, discuss your issues, see whether the issues can be resolved over the telephone, or they need to see you face to face. And if you don't have, telephone access, just let them know. They will see you, wherever it's needed face to face. So they will manage as per your needs. So, obviously do not hesitate to contact your GP practice if you have any medical need and you feel you need to get in touch with them. They've always been open. They are open, and they're there to obviously serve the needs of the public.
That's excellent. Thank you very much. So it's really loud and clear. GP surgeries are open. They're accessible. So if you have got any concerns and you have got any medical issues, please go and see your GPs, and they are open. So actually, I just wanted to say a big, big thank you to you and the teams that are working in primary care. All the doctors, the nurses, the support staff, the cleaners, everybody working incredibly hard to make sure that they look after their patients. And a big thank you on behalf of Radio Ramadan and the patients and the public of Leicester and Leicestershire for all the hard work that you've been doing in primary care. Really, really appreciate it.
Thank you very much. No, it's been a very, we would just love to do this for our public. Thank you very much.
Thank you. And now joining us, we've got Karamjit Singh, CBE, who's the chairman of Leicester Hospitals. Good evening, Karamjit. I hope you've been listening into our conversation along there.
I have. Good evening, Zuffar.
Thank you very much for joining us this evening. I really appreciate it. You're listening to Radio Ramadan on 87.9 FM. Our text number is 0774 8855 and our telephone line number is 0116 4822 086. You're listening to Radio Ramadan on 87.9 FM. Karamjit, you've been the chairman of Leicester Hospitals for how many years, and how did you end up in that role as the chair of such a big hospital trust?
7 years. I've been in that role for 7 years. It was an openly advertised process. I also have to say that a month from now I'll be marking 50 years of working life in the public sector. So,
wow. Fantastic
and for me, it's been a great privilege because the Leicester Hospitals are the 5th biggest NHS hospital trust in the country. We employ 16,500 staff, 36% of whom are from BAME backgrounds, mainly, obviously, a very high proportion of South Asian staff, and so that's over 6,000 BAME staff. We're probably the largest employer in Leicester, Leicestershire and Rutland, and it's been a great privilege to have been chairman of the trust board and chairman of the hospital trust in that period. But I was approached by a headhunter, by an executive search firm. I didn't know that the job was being advertised, and they asked me to apply, and I thought about it, and I applied, and obviously I was very pleased to be appointed.
Karamjit, how many people from BME backgrounds are chairs of any hospital trust as large as this in the country? And there's quite a lot of hospital trusts, over 100. But how many are actually from the BME background?
Well, there are 120 hospital trusts altogether. I think there are 9. Well, there were 10. Obviously, there'll be 9 after tomorrow when my appointment comes to an end.
You're retiring in your date.
This trust was the largest.
Yes.
Some of the other chairs are chairs of mental health trusts and community trusts, which are much smaller.
And you mentioned there that you're a role model because lots of Asian people look up and think we've somebody who's made it to the top, and it is right to the top of the NHS virtually, as far as most people can go by a long way. You're talking about 36% of the hospital trustees from BME backgrounds. Lots of people are listening into this thinking, well, how do I get a job in the NHS? What is the best website they look on, and what should they be doing? And is it a good career to be in the NHS?
Yeah. I think the public sector is a good career anyway. But I think that the issue about the NHS is that there are 350 different types of roles in the NHS. When people think about the NHS, they invariably think about doctors and nurses. And of course, they are a really important part of the workforce. But when you have very large, complex organizations like our hospital trust, you need to have lots of staff in allied health professions. You need to have a lot of support staff. For example, over the past few days, I've been going around the 3 hospital sites thanking staff. And at the Leicester Royal Infirmary, the first group of staff I went to thank were the catering staff, not just those who work in the restaurant, but those behind who actually prepare the food. Now, they're really important because they are preparing the food that goes to our patients, and they play as important a role in the hospital as our doctors and nurses do. And I think that I would say to people, and there are many people who I think have been rethinking, particularly during the pandemic, have been rethinking what they want to do. And I think it's been very obvious to me that there are a number of young people who have been very enthused by the care and compassion that staff have shown. And I think that a number of young people are applied for medical nursing courses.
We're just going to a break. Sorry, we're just going to go to a break, and then we'll join you after the break, and we'll just talk about the jobs element properly and the websites. So you're listening to Radio Ramadan 87.9 FM. Assalamu alaikum, brothers and sisters. You're listening to Radio Ramadan on 87.9 FM. I'm your host this evening, Zuffar. We're talking about the NHS, and we have a very, very special guest in the studio today, and that is Karamjit Singh, CBE, who's the chairman of Leicester Hospitals. We were just talking about jobs, and I was amazed to hear, Karamjit, there's 350 different types of jobs at the hospitals, not just doctors and nurses, but 350 different types of jobs. Wow.
Yes. If you think about it, Zuffar, in large complex organizations, you will need to have different sorts of management skills. For example, accountants, you will need to have managers who deal with logistics. If you think about people who procure different services, if you then think about even people in roles, porters, security people, catering, and all these different roles are on something called the NHS Jobs website. And I would encourage people to look on that website, and they will see literally every single role that is listed with every hospital trust in the country. So I think that that's where I would want to encourage people. I mean, we are probably the largest employer in this part of the country.
And that is the NHS Jobs website. So if you search online for NHS Jobs website, you'll see all the vacancies come up for Leicester hospitals. And currently, the figure that you've given us is 16,500 people work at Leicester hospitals across the 3 sites?
Yes, across the 3 sites.
And then if you add in probably LPT, which is the other organisation, the Leicester Partnership Trust, and then if you add in the CCGs, the clinical commissioning groups, and the GP surgeries, there must be something to the order of 40,000 jobs in the NHS in Leicestershire.
Well, there must be. There must be certainly well over 30,000 and possibly as high as 40,000. And if you think about it, that's probably, in terms of sector, probably the largest employer in Leicestershire and Rutland.
And they are reasonably well-paid jobs. I was speaking to some staff in the NHS in management and some of the other fields, and they are reasonably well-paid jobs with a great pension as well.
Well, they are, and I think they're very secure jobs. They're very well-paid, but also I think they're very satisfying jobs because you're serving your fellow members of your community, and I think that in healthcare. Care and compassion and having those values is something I think that all of us have within us, and I think that this is serving. And if you think about it, so often people come into contact with complete strangers, and it's providing a service to complete strangers.
I know when I've been in hospital with any of my children, or if I've been in, I just find the staff absolutely amazing. The way they look after the patient, the way they care, and they're there because they want to actually do the job and they want to care for patients, and it's fantastic to see. And you lead that organisation. It must make you very proud to see your staff and people that work with you deliver such great care.
It is, and one of the great joys. Pleasures of this role, and unfortunately it hasn't been so possible over the last 12 months because of COVID. There's always been the opportunity to go around, visit the wards, meet staff, talk to staff, and also in terms of my monthly messages that I send out to all staff is to always say that, look, we are here because we're here to look after our patients. That's why this organisation exists, this service exists. That's why all of us are working to that objective. And I mean, for me, that's been one of the absolute highlights, and actually the greatest source of pleasure. It's not, obviously an important part of my role has been sitting in board meetings, committee meetings, but the key issue has actually been to go out there, to engage with our patients, and also to engage with our staff and listen to them, and take on board the points that they're making.
Yes, and you're due to retire. Tomorrow is your final day. You've been here at Leicester Hospitals for 7 years. And, you know, in those 7 years, there's lots of things that have changed in Leicester's hospitals. The hospital has moved forward in lots of senses. We've had the brand new state-of-the-art A&E department that's been opened, both adults and children's. We're currently working on the brand new children's heart unit at the Royal Infirmary, brand new children's hospital. We've had the new multi-storey car park that's been built at the Royal Infirmary site. You had one of the largest contracts cancelled on a company that wasn't providing good service for the patients and the staff. And you know, you've achieved many things in those 7 years. What is the thing that you most think is your biggest achievement while you've been at Leicester Hospital? Certainly you've made an impact on the patients and the staff of the hospital, but what is your personal highlight?
Well, I think it's all the points you've talked about there, Zuffar. I mean, I don't take it as an individual personal achievement. I think it's an achievement on behalf of the organisation as a whole. For me, the privilege has been that I've been in the position of chairman and clearly have been able to participate in this, because at the end of the day, I think leadership is about working together with the people you have. We're all part of one big team. For me, the issue is about that I do feel we have tried to make things better for patients. And I think for me, one of the key achievements was that last year we were given a rating of good by the Care Quality Commission for the quality of our patient services. Now, you know, that's not a very easy thing to achieve when you think that we have over 100 wards throughout the organisation. So that means in terms of infection prevention, in terms of the quality of care we're giving, and that we have nearly 80 different kinds of services in the hospital. So for a big organisation to actually achieve a rating of good across all those services means that staff working together. And this can't be just simply because I, as chairman, ask people to do this. This has to be because the staff themselves are committed and they have put the effort in. And that's been my privilege to be there as chairman of the board.
We've been interviewing many people over the last few weeks on the NHS show, and one of the consultants that was in here only a few weeks ago was saying to me that the chairman has been one of the best chairmans that Leicester Hospitals has ever had, and he's very humble, and he's been round to the wards talking to the staff, regardless of whoever they are, and you've marked lots of people's minds with that positive image of your dedication to your duty and making sure that you've talked to staff across the board and you delivered for patients and on lots of different levels. You're going to be a tough act to follow for the next chairman, and you know, and you've been a great role model as well for lots of people to say, actually, you know, it is achievable for somebody to become from the Asian background to become a chairman of a hospital trust as large as somewhere like Leicester, and you know, there must be times where you've been frustrated and it's been challenging and you've thought, oh, I'm not doing a brilliant job. Have you ever felt that as well?
Yes, I mean, I think, look, life is never a smoothly upward moving escalator for us. We all have challenges in our lives, you know, professional and personal. And certainly I've had challenges in my professional career. I have been fortunate in the sense that since the 1980s, I've been the most senior person of colour in whatever organisation I've worked in. So I've in a sense, that's been a very lonely position. But the one thing I have learned is you need to have personal resilience. And I've looked at the experience of my parents. You know, my parents came from India. I was born in this country. My parents came from India. You know, my mother was completely illiterate in Punjabi and English. My father was a peddler when he came here. He was a foundry worker. He left school when he was 14, but they gave me my values. You know, the issue of hard work, the issue of understanding the meaning of seva and public service, and also the importance of having a strong set of values and resilience. And I think that is really important. And I think that the issue of, of looking at people, when I go around wards, obviously I speak to consultants and nurses, but I also make sure that I speak to domestic staff and the cleaning staff and whatever, because as far as I'm concerned, they are all part of the same team. And that's what you have to give to people. You have to give them that sense that they are being included. And I look at some of those staff and I sort of wonder, I mean, I talk to them because they have the same aspiration. They want their children to be educated and they want their children to advance. And I think the issue is, I really hope that over the next few years that we see more people like us who are actually in senior roles. And I feel we've started to make a beginning. We have 36% of the staff at Leicester hospitals who are from BAME backgrounds. If we count the consultants in, then we have 29% of people in senior positions from BAME backgrounds. But if we take away the consultants, and if we look at just the other senior roles, then the figure drops down to 16%. Now that's an improvement from where we were before. When I first started, the figure was 8%. So we're moving up. But I think that we need to move up faster. And I hope that in the future that will happen. Now, that needs to happen in an area like Leicester, which is diverse, and I've worked in Leicester, and I have members of the family that live here. So I understand Leicester very well. But I think that that is something that we all need to work on, because we need to have institutions, large and small, that reflect the community that they serve.
Exactly, and I think that's a real good point. The hospitals have been integral in this COVID battle against COVID. You've had thousands of patients come through the hospitals. It's been extremely busy for the last 12 months at Leicester hospitals. How are the staff and how are people feeling at the hospitals now they're coming out of this wave in particular?
Yeah, I mean, I've observed this over the last 12 months. I think staff have really worked very hard. It's been very traumatic because, and your listeners will know this, that obviously, as our colleague was saying earlier, we have suffered in terms of our local communities. And don't forget that many of our staff live here in the city as well. And therefore, they will have seen colleagues, and they will have seen members of their own families possibly, and equally their extended families who will have suffered from COVID. So it's been a very traumatic time for them. They're also very tired because they've worked so hard. And I think that we have to kind of obviously, and I pay tribute to them for everything they have done. And there have been times when we have been very close to a very difficult situation. Fortunately, we never ran out of PPE. We never ran out of the need for oxygen. We managed to deal with the patients who came into us, so we were not having to turn people away. But as you can see, tragically in India today, that was a scenario that we were planning for, and I'm pleased that we never got to that. But I do also recognise that unfortunately we had well over 1,000 people from this local area who died during the past 12 months. So, we have to kind of recognise that this has been a difficult time for our communities and indeed for our staff. But they have done everything that we would have, we could have wished for them. They really have worked very, very hard. And the challenge now, as you say, the numbers are going down in terms of COVID-related infections. The challenge now for the hospital will be to catch up now on waiting lists and to move forward in that area.
You know, it's been 12 months. I know lots and lots of people have been down to the hospitals, donations of PPE, of scrubs, of gowns, of gloves, of water, of pizzas and food. And I think for weeks and weeks and weeks, there was lots of people delivering things to the hospitals. How has that made the hospital staff feel? I know there's been lots of, appreciation, but how has that made you feel as well?
Well, it's made me feel, and I'm really proud, and thank you for reminding me, because I should have said that as well, that in addition to the staff, that actually the communities have really rallied round, and they've really been supportive. And actually what this tells me is that people see the hospitals as their hospital, because obviously not only are our staff, are they members of our staff, they're also members of those communities. And, quite frankly, we were absolutely amazed with the amount of goodwill. I mean, just giving the example, for example, thinking about food, when you're working, as people were working in our emergency department, in our other wards, they're working non-stop to receive the offering of food that we received from restaurants, from takeaways, from all sorts of other places, just to give that as an example. I mean, that was really appreciated. And it was a great morale boost for the staff. So the people, and I think that really the feeling you have then is that the hospital is not apart from the community, the hospital is a part of the community. And I think that was really, really fantastic. And I would like to take this opportunity to give my heartfelt thanks to everyone in the community who assisted in that.
Thank you, Karamjit. I just wanted to say finally, I know you're retiring tomorrow, and a real big heartfelt thanks from all of the public of Leicester and Leicestershire for all the hard work and dedication you've done over the last 7 years to making sure that we have a great hospital, a great future, looking after the 16,500 staff, as well as all the millions of patients that go through UHL. And what a fantastic credit you are to the Asian community for the diligent work that you've been doing for those 7 years. You certainly make people like me proud, and lots of thousands of other people that I speak to on a doctors and nurses who have spoken to me said how sad they were to see you leave. But let's hope that you move to pastures greener and you're doing something else and supporting the community in lots of other ways that I know you will. So thank you very much for joining us this evening. Really appreciate that.
Good. Thank you.
We also have Deepa on the line. Good evening, Deepa. I hope you're well. You work for Leicester City CCG, the Clinical Commissioning Group, and NHS. What do you do for the NHS here in Leicester, Deepa?
So I'm actually a GP registration officer. So what we're actually doing is identifying patients within Leicester City that aren't actually registered with the GP practice, and just sort of encourage them to join now more than ever, obviously because of COVID, so that they can the practice and actually contact them to come forward and get vaccinated, but also to spread the information as to what they're entitled to, what treatments are available by joining a practice, because it's all free. Some people think that by joining a practice there is some kind of a fee involved. So I just wanted to obviously make people aware that when you join a GP practice, there's no cost involved.
There's no cost involved. And
it's free as well.
It's free as well. And you don't need to know their immigration status. That's also gone as well, so they can register. We've only got a minute left, so I'm just trying to be succinct, please. Is there a contact number or a place where they can get further information if you want to give that out?
Yes, so if you just go onto NHS website, if you type in find a GP, there's a link and there's actually further information on there regards to actually finding a GP practice. So you literally just put your postcode in, or if you go onto the Leicester City CCG website, our details are on there as well. So myself and my colleague Prakash has got our mobile number and our email address on there, so you can contact us and we can give you further information as well.
Excellent. Thank you very much. I know we're going to be plugging this for the next few weeks as well. And please, if you have not registered with a GP, please get registered with a GP. It's on the NHS Leicester City website. Take the advantage and make sure you go and get registered. You're listening to Radio Ramadan on 87.9 FM. I'm your host. Please join me again next week at 6 o'clock on next Thursday. Thank you very much.